HDR UK to start off the presentation. So Amanda, over to you.
Thank you very much, David. I'm just turning on my camera as well so you can see me. It's a pleasure to be joining everyone today. Just wanted to thank David, Sophia and Wendy for organising the session for us, and also to everyone for joining. We thought this would be a really good opportunity to introduce you to Health Data Research UK, as I think we've got many areas of synergy in terms of how we support innovation and improvement across health and care, and also to highlight to you some of the work that we're doing that I hope you'll be interested in, and that also may be of interest to some of the partners that you work with. So next slide, please. So Health Data Research UK is the National Institute for Health Data Science. We cover the 4 nations of the UK. Our mission is to unite the UK's health data to make discoveries that improve people's lives. So we have a really big focus on supporting the research and the innovation in areas that will really have an impact on people across the UK. So we know that the UK has got a really strong NHS, a very strong life sciences industry. We've got world-class academic institutes that I know that we all work with, and we've got a really vibrant tech community. And by using and enabling the use of health data provides all of these pioneers across these different sectors with an opportunity to drive innovation, grow the industry, and really take a more holistic view of how we can improve people's health. Next slide, please. So just to give you a bit of context, there's a really long history going back centuries of using data and information to enable scientific discoveries that have really transformed the understanding that we have around people's health, and also about different diseases and conditions. So when we're talking about health data research, it's not actually anything new. It's just often these discoveries haven't really made the link public around how data has been really transformative in that process. Next slide, please. So just to introduce you quickly to our strategy. Health Data Research UK was set up, we're now in our 3rd year, so we're still fairly young organisation, but we were established to maximise the value of health data. So our funders, who are public sector organisations across the 4 nations, really recognised that we were missing opportunities in how health data could be brought together for research. So we've developed a strategy of uniting, improving and using health data, all wrapped around ensuring that we are doing it transparently and safely and ethically, so that we can continue to build public trust and really demonstrate the benefits of health data and the research that is using that data. So within the uniting, improving and using themes, we have various projects and programs, and we also are building a kind of ethos of working within one institute. So we have a number of different areas within that in terms of training and skills development, because it's all well and good making this data available for research, but if there are not the people or data analysts and people with those skills to use the data, then we're not maximising that value as much as possible. So we have a training programme that has an ambition to train over 10,000 health data scientists, and this is moving forward really at pace, and a little bit later on in the spring we'll be launching a new virtual learning environment that will have many different courses ranging from people with advanced skills through to more basic skills, so that we can start to build this community of data scientists. Next slide, please. So we work across the whole of the UK. You can see on this map here all of our different locations. We have research locations, we've got health data research hubs, and then we've got training locations as well. Next slide, please. So one of the aspects of uniting the health data is that we have established a organisation called the UK Health Data Research Alliance. We are about to make an announcement in the next couple of weeks that will take the members of the alliance up to 50 organisations, and these are some of the biggest NHS and research institutes across the UK. And essentially, we're bringing these organisations together because they're the ones that are owning, controlling, and managing the data. And without them and without their contribution and their collaboration, we can't enable the access to those different data sets that they're looking after. So they're brought together under this umbrella organisation, and they actually work together on many different projects and initiatives, essentially around creating standards and common processes around data. One of the exciting initiatives that the Alliance has been working on and leading recently is an internship programme for young Black data scientists in the UK. Which we've announced recently that we're taking on 54 interns, 60% of those are female this summer, because there's a recognition that in the data science community that there isn't diversity of people, and we're not getting the diversity of skills and perspectives that are really needed to take this sector forward. So next slide, please. So I wanted to tell you a little bit about what we've been doing during the COVID pandemic. We initiated our strategy in March last year at the start of the lockdown, realising that we have many different connections across the research community in the UK, that we had an ability to be able to coordinate and connect that community so that we could really make bigger impacts in the research efforts. The other area is really accelerating access to UK data sets that would be a priority for COVID research. So we've really delivered that through the Gateway that you'll hear a bit more about later. And also leveraging the best of the capability that we have across the community. So one of the things that we implemented very quickly was a fortnightly task force call, which is attended by about 100 of the leading scientists in the UK, that meet at 8 o'clock in the evening to talk through some of the kind of latest research questions that are coming through, and really to share sort of skills and experience, which has been really fantastic that those meetings are still continuing. Next slide, please. We've also been reporting to the SAGE committee and also to UK Research and Innovation. So the role that we've had in terms of convening that research community has enabled us to really analyse some of the research questions that were coming through around COVID, and to look at where the impacts of those research studies have been made, and then to be able to share those insights with SAGE. So we've been providing these reports again for the last year. They go out every fortnight now, and you can find all of them on our website. And they're a really great source of information in terms of what are the latest research studies coming through, all the links to the different research papers. And we also, each time these reports go out, we have patient and public advisors giving their input as well, to ensure that the research is focused on areas that matter most to patients. And next slide, please. So we have a portal, a website called the Health Data Research Innovation Gateway, which Vicky will tell you a lot more about in a few minutes. But essentially, this is the go-to place for researchers to discover and request access to UK health data sets. And one of the biggest kind of priorities for us is to make health data research more transparent, both to the research community, but also to the public, so that they can actually see what data is available, and eventually how those data are going to be used and why they're going to be used. So this month we were really proud that we reached the milestone of 1,000 registered users. We get about 11 or 12,000 searches each month from around the world, and we've got about 640 data sets now discoverable. Next slide, please. So I'm going to tell you a little bit now about the Health Data Research Hubs, which were established in October 2019. They've just celebrated their second key milestone, which we've communicated today via a news story. So these hubs, many of them have got close links with the academic health science networks, in particular to mention DataCan, Discover Now and Pioneer. The idea is that there's centres of excellence available with research expertise available to improve health data and make it accessible and usable for researchers and innovators. Next slide, please. So here's just some examples of how the hubs have had an impact on particularly around the insights that they've enabled around COVID-19, but also the sort of general impact. So the hubs, when they were established, they had to demonstrate how they could bring data. The idea is that we don't want organisations just using the data for themselves. We want to make that open and discoverable for anybody. So they've made, in the last 18 months, they've made over 140 data sets available for research. They've delivered over 300 projects, many of which include industry. And we also have a large focus on patient and public involvement through the hubs. So we can share a link to the latest reports on the impacts of the hubs, which really shows how collectively the hubs have informed UK policy decisions around COVID-19, around things like vaccines, how they've used data to improve clinical decision making in patient management, and also supported research in cancer and heart disease. Next slide, please. So I'm just going to give you a couple of quick case studies now, because I think we're about to run out of time. We may have already run out of time. Apologies. I'll just run through these really quickly. But the principal trial is a clinical trial that was looking for patients over 50 within the community that had a positive COVID test, so that they could trial different treatments with the intention of trying to keep people out of hospital for their treatment. We worked with the DigiTrials Hub and with other colleagues at NHS Digital to ensure that some of the data was made available safely, securely, that it was linked up. And the result is that we greatly increased recruitment to that clinical trial. And they've now discovered that a very common treatment for asthma is one of the very effective drugs that can shorten recovery times for people with COVID. Next slide, please. And then the final case study is around how the Breathe Health Data Research Hub works with colleagues in Edinburgh University to look at a data set on the whole of the Scottish population, so for 5.6 million people, to evaluate the effectiveness of the COVID-19 vaccine. So this was the world's first ever whole country research on the AstraZeneca and the Pfizer vaccines. This work was announced by the Prime Minister. It was published as a research piece in February, and it influenced national regulatory strategy in the UK, Canada, Denmark, France, Germany. So it really shows that the speed of the access to the data, the ability to bring those different data sets together really does enable that real world insight very, very quickly. Next slide, please. Just quickly to say that we'll be adding some new hubs in the next couple of months, and the hubs are now moving into their next milestone, where they'll be required to make more data available, more projects, new research applications, and other areas. Next slide, please. And that's all from me. I will hand over next to Ralph Evans, who is the Commercial and Partnerships Lead for the Pioneer Hub, who can tell you more about the work that they're doing. Thank you.
Thank you, Amanda. So good afternoon, everybody. My name is Ralph Evans, and I'm the Commercial and Partnerships Lead for Pioneer Hub. I'm here today to discuss our hub's offer and explain how we would like to work with SMEs within your region. So Pioneer is the health data research hub for acute care, and we were set up in November 2018. So Pioneer was built upon the expertise of digital health, data curation, data sharing and analytics of University Hospitals Birmingham and NHS Foundation Trust, and University of Birmingham, along with other partners. Next slide, please. So our primary aim is to improve the health and well-being of patients through increased understanding of acute illness. Now, we define acute care as being any unplanned health episode. Data from NHS England shows that the National Urgent and Emergency Care Services respond to more than 110 million urgent calls or visits every year. So Pioneer aims to improve the understanding by better appreciating the diagnostic timelines, healthcare pathways and treatments that patients undergo. And this can include data from a range of settings, including primary care, secondary care, or even the ambulance service. Now, we achieve this through responsible data sharing with robust governance and ethics in place. So all applications for data are reviewed by our Data Trust Committee, which is made up of patients and members of the public, and all approved applications for data and any other supported analytics are all approved under license. So Pioneer's objective is to allow innovative healthcare companies to develop, test and deliver advances in clinical care utilising real-world data. And this covers a wide range of products and solutions. So it could be a company who have created a software that goes into a wearable device. It could be a company looking to test an AI algorithm that assists clinicians in diagnosing people with presenting at A&E with certain heart conditions. So all of these things can be created with access to our data and services. Now, these companies can be SMEs who are at the very beginning of their product development journey, or SMEs who are established companies with dozens of medical solutions. We are very much open to all. Next slide, please. So Pioneer is one of the most complete records of acute healthcare journeys available for research and innovation. Now, our data is condition and disease inclusive. It focuses on the patient in their entirety without a disease or organ-based approach. So Pioneer captures elements such as the reason for requesting unplanned medical assistance, the previous medical conditions, operations or procedures someone has had, any medications or allergies they are on, all vital signs such as heart rate, blood pressure, breathing rates, all laboratory tests as well, so blood or urine tests, all imaging reports and copies of de-identified images such as chest x-rays. We include complications of illness and new diagnoses, so heart attacks or strokes that they may have had, the severity of the illness, so were they admitted to intensive care, breathing, or was other organ support needed. Any patient transfers that may take place within the hospital, so between an A&E department and wards or the intensive care units. We also have the final outcomes. So was the patient discharged to their own home, new social care setting, or anywhere else? And also what further outpatient care was organised, so referrals to clinics, physiotherapy, or further tests were ordered. Now, to give you some high-level numbers, we have approximately 21 years of longitudinal data comprising of just over 1 million distinct patients. So this includes counts of 70 million drug administrations, 100 million blood pressure readings, 200 million blood test results. Our data can be refreshed in near real time for the study purposes, and organisations can request multiple data drops if needed. Now, to see more on the datasets that we have, you can click on the image in the slide deck when it's sent round, and you'll be taken to our website where we have a whole page dedicated to this. Next slide, please. The data service is available. So there are a number of considerations when looking at what Pioneer offers. So the first thing to consider is that data access is licensed. So this means that researchers can only use the data for the purpose on the license and not any other project. Now, it also means that data cannot be shared beyond the license agreement, and it also means that the data provided is selective and sufficient, so it's enough to answer the question of the study, but we don't give out any more. Now, data is shared only when data security has been agreed and approved by Pioneer. I'll cover the application process shortly. So usually this means that data is only shared in a trusted research environment. So Pioneer's TREs do not contain any health data not directly related to the project. The data does not leave that TRE, only the study outcomes. And once the data has been used to answer the specific project, usually after an agreed period of time, the data is removed and the TRE is then closed. So the data services offered by Pioneer are varied. And when we commence discussions with organisations, we raise this early to ensure it can be factored into their thought processes. So I don't have time today to cover the costing model, but please drop me an email if you're interested and we can have a separate call. So there are two broad services on offer, these being data as a service and consulting as a service. And these can be accessed independently or as a combined offer. So data as a service operates on the principle that we extract, transform and link the data, often from multiple sources and providers. We then enrich the data by cleansing and anonymising it along with other processes. So this means that we then create a bespoke data set, which is in a format that allows companies to make actionable insights immediately. Now, the consulting services are provided by our team of analysts and clinical staff. So examples of things we've previously offered include data insight and analytics, so artificial intelligence, algorithm expertise, and also clinical access to some of our clinical experts to assist in study outcomes. Next slide, please. So the application process is split into 5 stages. So process 1 is the application itself. So the inquiry comes in via HDR UK portal or direct to Pioneer via our website. The commercial team will then review and respond, and then we hold an initial meeting where we discuss the application, looking at the study purposes. In process 2, what we do is the review. So we conduct a data scoping exercise. So this allows both sides to understand the data being requested. The requester finalises the application along with any consulting services they may need. We then produce a quotation which is sent and subsequently approved. Then we do a data request form which is completed along with the data fields that the requester would like. This moves to the approval process. So this is where our data trust committee that I mentioned earlier meet and review the application primarily from the viewpoint of a patient benefit. Providing that's agreed, we then proceed, that is then fed back to the requester and we move on to the commercials. This is broadly split into 3 phases. The first is the TRE, so the trusted research environment, how you access the data. We do a range of TREs. We either have our standard or we can build a TRE to suit the purposes of the organisation. We also then sort out the contracts, so how we actually go about signing off the data for your access, and then the data set itself, where we make sure it's actionable out the box. The 5th process is the access. So this means that the data set is available to access, usually via TRE, along with any associated consulting services the company may have bought. At the end of the agreed study period, the access can be extended or the data is removed and the TRE is taken down. Next slide, please. So I hope that has been very helpful in giving you a very quick overview of Pioneer and our range of services. Please feel free to contact me directly to set up further calls, and I can cover more areas in greater depth if you wish. Thank you.
Hello. Hi everyone. I'm Vicky Helen. I'm a Gateway Content and Community Lead at HDR. So I'm going to be talking to you today in a bit more detail about the Health Data Research Innovation Gateway, which Amanda introduced at the start. Next slide, please. So one of the pillars of HDR's work, as Amanda kind of introduced, and one of the things we initially looked at was what health data sets exist across the UK. And what we found out, and what is well known already, is that health data sets across the UK are fragmented and held separately across a real range of organisations. But to give you some example numbers, so there's 300 NHS trusts and 10,000 GP practices in the UK. So if you can think about the other range of organisations as well, that's a lot of data split up into a lot of different places. So it's difficult for researchers to discover what health data sets actually exist. And then when they do discover these data sets, it's actually difficult for them to discover information about the data set and whether it would be of use to their research. So this is really the rationale behind the gateway. Next, please. So what we want it to be and what we've been working on over the past year is making it the go-to resource for discovering data sets in a transparent manner, as Amanda mentioned, but also providing that access route as well, and also helping researchers discover other health data resources that can ultimately lead to further health discoveries. Next slide, please. So the gateway set up last year, and it's grown and developed really rapidly since then as a directory. So we now have 640 data sets, which are listed on the gateway through our Alliance members, which the hubs are also part of as well. So the important distinction here is that the gateway doesn't hold any data. The data still sits with the data custodians, but the gateway is listing information around the data sets, which helps that discovery process. And as you can see, as Amanda mentioned, we've now got over 1,000 registered users, which is growing every day. And we've had 252 access requests and inquiries for datasets via the gateway so far. We've also added other health data resources to the gateway, so health data tools, academic papers and projects as well, which I'll go into a bit later. And we also have a community forum, which you can see on the right, where you can give feedback on the gateway, find our how-to videos, and we're also hoping to kind of generate some more general health data discussions around there as well. Next slide, please. So what data sets are listed on the gateway? It's a real range in discipline, considering kind of the range of members that make up the Alliance, so from kind of NHS Digital to UK Biobank and HQIP, so data sets in area of kind of cardiovascular, maternal health, and also data sets covering the areas that our hubs are in as well. And there's no surprise, we also have a lot of COVID-19 data sets on there as well, which have kind of been proved to be our most popular data sets. So you can see on the right hand side here, we have the COVID-19 Zoe symptom tracker app, which many of you might have, which is our most requested data set on the gateway. Our Moorfields iImage dataset also gets a lot of requests. And then recently we also added the COVID-19 vaccination datasets as well. So really excited to have those kind of on the gateway. Next slide, please. So I don't have time to demo the gateway today, but I'm just going to show you some screenshots of what it looks like kind of searching for a dataset on the gateway. So you can see here, I've done a search for X-ray, and then next. You can see the filters here on the side. So once you kind of carry out a search for data sets, you can drill down further if you need to. And then if you click on the actual data set itself, so next, here I've kind of clicked on the National COVID-19 Chest Imaging Database. So you can see there's a description around the data set to give kind of anyone who's looking for this a bit more information about what's contained in the data set. And we also have a metadata rating next, which you can see in the top right there. So the metadata rating is either bronze, gold, silver, or platinum. I won't go into how this is calculated for now, but the aim is to give researchers a quick eyeball of how much metadata is available around the data set. And we're continually working with data custodians to improve the quality of metadata listed on the gateway. And then next, if you kind of scroll down further on a data set, you can also kind of see more information. So this varies according to data set, but things like age range, processing time, kind of coverage of the data set, which can be useful as well. And then next slide, the technical details here. So around half of the data sets listed on the gateway will have these technical details, which actually tells you some of the fields that are in the data that exist within the data set. So all of this is really aiming to allow researchers to be able to easily see the details around the data set and therefore kind of save them time and working out whether a data set would be useful for their research. And also as well, we really want to save the data custodians time. So with all this information available on the gateway, they should have to answer less questions from kind of researchers about what's actually in the data set as well. And if you click that request access button that's in the top right, next slide, there's kind of two data access routes that you'll be shown depending on which data set it is on the gateway. So some of our data sets just have a simple inquiry form, which will just connect you up with the data custodian. But other data sets are using our DAR form, which we designed with data custodians as part of the Alliance work. So this is based on the ONS's 5 SAFE principles, and the aim is really to kind of harmonize the questions that data custodians are asking researchers. And we really want to kind of increase that efficiency for access to data sets and get to the point, particularly with this form, where you could just use one form on the gateway to request multiple data sets from multiple custodians and not have to kind of answer different questions depending on who's the data custodian. Next slide, please. So we create resources on the gateway via collections, and this is also how we represent the hubs on the gateway. So they're kind of front door on the gateway. So you can see on the right here what Pioneer looks like, where it's got a brief description. And then it also kind of curates all its outputs on the gateway. So we've got the Pioneer data sets represented, tools, papers, and projects. So as Ralph mentioned, this is one of the routes where if you did want to request access to a Pioneer data set, you could do this via the gateway. And also we want to get to the point where we're kind of representing all the different health data outputs on the gateway. Next, please. So what you can see here is this is a national neonatal research database, but it's got related resources. So if someone requests access to a data set, then we'd like them to put their project on the gateway. So people looking at that data set down the line can see what projects are already working on that data set, and then also put their papers on the gateway as well. So you see those kind of full range of outputs. So that's represented here with this data set, where you can see kind of related papers and projects to that data set. Next slide, please. And then finally, kind of the future and the next steps for the gateway. So we're continuing to add as many data sets as we can onto the gateway and facilitate features that facilitate discovery and access. So our next milestone of development is happening at the moment. We're focusing on data access request features and also our new cohort discovery tool, which you can see whirring away in the background here. So the idea behind this tool is that it really kind of improves the search on the gateway, and you can kind of query certain demographics or certain kind of aspects of the data. So for example, here you can see you can pull across kind of female and asthma, and then this tool will let you know which data sets on the gateway kind of contain patients that have those aspects and what would be kind of useful for your research. So we've just uploaded 4 data sets into this tool, but we're really hoping to kind of spread this out across all the data sets across the gateway. So really kind of advanced search, so people can really drill down and work out, which aspects would be useful for their data sets, and more importantly, which data sets are important, which could be useful for their research and going on to make discoveries. So next slide, please. So that's kind of whistle-stop tour of the gateway. We would encourage you to go onto the gateway, register, kind of explore the data access process as well. We've also recently set up a development and improvement group. So if you're interested in the design aspects of the gateway or developing new features, email me for more information about how to get involved in that. And then lastly, we run monthly open door sessions where, again, we kind of talk about new features on the gateway or how kind of HDR internal teams are using the gateway and external teams as well. So the hubs, we recently had the BHF Data Science Centre. So this month we are having the National Course Studies team who are running programs for COVID-19 questions come along and talk about how they're using the gateway. So it's completely free to register, so we'd encourage you to do that if you're interested. And that is all from me.
Thank you, Vicky. So if I could ask all 3